Hello, and welcome to the Ascend Health Show. I'm your host, Nick Angelis. I'm a nurse anesthetist and one of the owners of Ascend Health Center, and I'm here with Dr. Valerie Creeder. How are you today?
I'm well, thanks.
So what's fun today is that one of my contacts is bothering me, so I'll probably look like I'm sobbing at certain points during this, and it'll just be very powerful for all the viewers at home. Like, he's really touched by this. This is great work that they're doing. Which is because we're talking about group therapy.
Right.
Which is a little difficult to do over a WCTV episode, but you know, you can get your money's worth, it's fine.
Sure.
And there's usually a disclaimer that anything we say here, it shouldn't be taken as medical advice. Just as anything you Google isn't always personally applicable to you, that sort of thing. So, have you had a good day so far?
It's been an excellent day. Yep. Hanging out, going to meetings.
I went to Columbus to talk to a new ketamine clinic about Spravato.
Oh, yeah.
So I talked to them for about 2 hours, so I might be a little hoarse, but that's probably good, because that way we can listen to your wisdom instead of whatever I come up with.
Whatever there is of it, yes.
So it was really insightful, so I enjoy that sort of thing.
Cool.
So I want to start talking about group therapy, because you're going to start doing some group therapy for us at Ascend.
Right.
And sorry for all of you, this is basically a planning session and you can come along and see what we're going to do. But I'm just so intrigued by it, because we did group therapy right before COVID started. It was a PTSD group for women who had just suffered various traumas, and then we tried to do it virtual during COVID. If you remember that glorious time 2 years ago when everyone tried to do everything virtual.
Right.
And we all realized what works virtually and what doesn't.
Right.
Which that in particular did not.
I imagine it didn't work very well, yeah.
So what does help group therapy to actually be beneficial and help people?
A lot of what is helpful about group therapy is that it's normalizing. So instead of just feeling like maybe I've got PTSD and nobody else does, or I've got an addiction and nobody else does, we enter into a group where many people have similar issues that happen, and all of a sudden we're not alone. That's really helpful. Another benefit of group therapy is that we have the opportunity to get feedback from other people in a non-judgmental way. And so if I'm concerned about something, if I've had nightmares that I need to discuss, getting feedback from other people in a non-judgmental way is really helpful. It's not threatening, and there's a facilitator there to interpret and guide the discussion. Yeah.
So a lot of it is the facilitation.
A lot of it is the facilitation, right. And a lot of it is the orientation with which the group is run. So a Gestalt group, for example, would be very different from a CBT group, for example.
Okay. And I think too, because a lot of our patients find some support from their loved ones, but their loved ones are also enmeshed. In many cases, it's very complicated, where it's like, well, this is the person who hurt me and also the person who healed me. And it's this gray area where, like, a lot of times it's an overprotective parent. Like, in part, they're the cause of the issues, but in another way, they're also why the person's getting better, and it's hard to distinguish all those.
It's really hard to distinguish that, and enmeshment does happen in the family because families were developed so that we survive, right? And so we were supposed to help each other back then. And today, families want to help out so much that they end up enabling, or they have their own issues and there's a lot of friction that happens. In group therapy, we can take a look at the family dynamic of anybody that's in the group, and we can actually sculpt their family using members of the group to get a visual picture of what their family really looks like in terms of who's closest to who, who's allied with who's standing far apart and distant, and begin to look at how this person wants to see their family, maybe wants to create some change in the family. And we can begin to work with techniques like that.
So you're saying it's a safe space to explore the different relationships?
Yes.
Because you're not doing it right there with your family.
No.
So instead of the, like, over Christmas dinner, let's talk about why Aunt Martha has been such a problem.
Exactly. And role plays and all kinds of, feedback the whole time. So it's very powerful. I find it way more powerful than individual therapy a lot of the time.
Yeah, I see what you're saying. And is there anyone who it isn't appropriate for? Because I've always thought of it, well, if you're extroverted, then this is great, but then there's also the risk of you have 20 people all trying to talk at the same time, which I realize is the facilitation that you're so well trained in. But
right. Well, we wouldn't do a group with 20 people. We'd only do a group with maybe 8, something like that. And there's always kind of like ground rules, you know, whatever stays in the group stays in the group, you know, so there's confidentiality at play here.
that doesn't make sense, though, because even with, not to interrupt you, because I'm sure you're about to say something wise, I was thinking of it as this is something for extroverts, but as introverts, people who are introverts are always reading these articles about how you can express yourself, and I like the joke of like, well, why isn't there anything about extroverts telling them to shut up and listen a little bit better?
Well, introverts and extroverts, you know, there's a misconception about them, I think. So people who are extroverts get recharged by being around other people. And that's where they get their energy from. So when they're wiped out, it's been a hard day, they want to go be with people and hang out and talk and express. Introverts get their regeneration from being alone, but that doesn't mean they don't have social skills or they don't want to interact or they can't. When I take introversion, extroversion scales, I'm at the way far end of introversion. In fact, everybody in my family is. And when you walk into our house, like even the kids are studying or reading, or, you know, my husband and I are doing research or something like that. We're like quiet in our house. But we're, you know, it is not overwhelming to be an introvert in a group. And when you're an extrovert, sometimes, you know, people get overly extroverted and talkative and stuff, and so that's fine. We just learn to work with that and learn boundaries and all the kinds of things that help us all get along socially in the world.
And a lot of it too is about comfort. Like if you're an introverted person, you can be next to someone and you're both reading separate books and you're enjoying their company.
It's exactly right. It's okay not to talk. It's okay to be silent.
Right.
Yeah.
And sometimes extroverts, because I'm pretty extroverted, and I try hard not to talk just to fill up space. The knowledge that, you know what, some silence would be really a lot better than me prattling on about nothing important. So that's great.
Yeah.
So the disadvantages, since I'm always a devil's advocate, and it's more fun to talk about why a group wouldn't work than why it would be so wholesome and helpful.
Right.
You know, if you have people who are talking too much or talking too little, bringing that balance. But again, you said it's a facilitation. And I think what you're also getting in touch with is that part of the reason it works is because the group members are involved in discussing problems or coming with solutions. So it's not this individual, like, just this affirmation for an hour that you're great, you're special, go out there and live your life. It's we're coming together, and as a group we're solving problems, and maybe I can't relate completely with one person's issue, but in helping them think through it, I'm training my own brain to think through the issues that I'm coming with.
I always loved that Saturday Night Live skit with Stuart Smalley. Remember him? Like, I'm great and everybody's okay and I like this best and everybody likes me. And that affirmation stuff is, you know, if you can't wrap your brain around what you're saying, whatever affirmation somebody gave you, it's not going to work, right? And so rather than affirmations, we talk about reality-based characteristics, abilities. Affirmations aren't really affirmations, but a declaration of who I want to be, who I'm becoming, you know, and holding solid to that.
Right. So you're saying more of, here's how we're growing, here's what the next step is. And even if it is something of, hey, here's something I need to fix. Like, I've been reprimanded by people, and at first it's always hard, but it's like, oh, this is great. Like, we have a relationship where they feel they can speak into my life.
Right.
It's sort of how, and I think I've mentioned this before, I've had times in my life where I'm like, this is great. I don't have any friends that I have to help move or take to the airport. That really means I don't have any deep relationships in my life.
Right, right.
I mean, I'd help you move. I really would. As long as it's like for a few hours and I get pizza afterwards.
I'd pay you.
Yeah, I think we're at that level. But there's something to be said of, sometimes life can be going well, but it's because we've removed all the hardships because we just aren't willing to tolerate them. And you're saying that the group therapy can help gain some of that resilience again.
Absolutely. And it's not fluffy, and it's not often fun and exciting.
Right.
It's hard work. It's really hard work to get the motivation and to really work at discovering who you really are.
Right.
In Gestalt, actually, we say the more you stay the same, the more you change. It's almost like the more you know yourself, the more you realize how much is available to you in terms of your characteristics and your abilities and your strengths.
So you're saying, like, as you get rooted into who you are, then you have the capability to change, because every wind of life isn't going to knock you over.
That's exactly right.
Okay.
Right. And, you know, in learning Gestalt therapy, we all had to go through Gestalt therapy for quite a long time. And one of the things that I always tried to do is wipe out my anger. My anger was always an issue for me, interestingly, because I looked like a nice petite little thing until I put a hole through my therapist's wall.
Right. Or until I don't show up to help you move.
Right. And so what I have learned from Gestalt therapy is that all of the pieces and parts of us are valuable, even the angry, dark spaces. The more we get to know those angry and difficult places that we want to avoid, the better we are able to utilize them effectively in our life in an appropriate way. So it's not about lopping off something that you don't like about you. It's about getting to know it really well and learning how to make that meaningful and effective in your own life.
So is it using negative emotions as clues? Like, oh, I'm angry, let me hold this up and find out why this so deeply affected me?
First of all, anger is not a negative emotion. It's just an emotion. They're not bad or good. So ask that again.
And this is for my own therapy.
Yeah.
Sorry again for everyone watching. It's just about me today. So are you saying that instead of lopping off negative emotions and trying to be positive and Instagrammy every day, let's filter everything, that when we have those negative emotions, we get to hold it up of, okay, this is a deep emotion. What is this leading to? Why am I feeling this way?
What is this about for me? What strengths do I have that comes from that anger? I used to never be able to talk in front of groups. Now I teach all the time. Mm-hmm. Now I go out and lecture, and you know, I'm on Zoom. I'm doing shows like this. It used to scare me to death. Mm-hmm. So that fear turned into a big strength for me because I like a good challenge. Right? And so I had to find all those pieces of me to make it work.
That makes sense. Like, I was always good at taking tests when I was younger because I viewed it as, okay, this is a challenge to prove myself. Mm-hmm. If instead it was, oh, I'm going to take the ACT, and if I don't do a good job, I won't get any scholarships, then you're going to be, you know, coloring in all the circles with anxiety, and your brain's going to try to survive the test as opposed to trying to access those deeper parts of your brain that can sort through profound problems.
Yeah, that's a good analogy. Yeah.
Well, usually I use it to explain the ketamine at our clinic, that it's sort of like, you know, when you first are suffering with depression, it's almost like you're trying to run away from a lion and you're also trying to do math.
Yes.
And I'm not always sure which one we're removing, the math or the lion, but either way, life is easier to deal with, which I think is actually more important than just removing a negative emotion, because then you're fine until the next negative emotion comes along.
Right. So, say that again for me. I'm curious.
Yes, it's usually a problem with me make up analogies on the spot. So a lot of times with either PTSD or any debilitating issue, depression, anxiety, it's almost like the double whammy of it's something difficult and complex, but it's also triggering the part of us that wants to run away or fight or fawn. So it's that combination that makes it overwhelming.
Yes, right. And
like you see that in movies too. Like, oh, I've got to defuse this bomb before this happens. And and in my line of work of anesthesia, that's how we're trained too, that I need to intubate this person before they die. So it's the combination of higher brain function and rudimentary technique.
Right. But for human beings, when we face something that we're afraid of, we naturally want to hide, right? We would naturally want to get away from something distressing. But what we find is that the more that we do that, the worse the anger gets, the worse the fear gets, the more we run away from it, the bigger and badder it gets. And so in therapy, we try to find parts of self that are willing to stay with the fear, stay with the anger, and confront the situation without running away. And that makes the trouble and the pain way more manageable. Right? Does that make sense to you?
So
you look a little confused.
Oh, no, I'm trying to think of it in physical terms, since again,
okay.
So it's almost as if some patients, if they have an autoimmune disorder, for example, they'll say, I hate this, I can't wait to get rid of it. And sometimes it actually fuels the autoimmune disorder because it's in themselves. But you're saying when we see ourselves in these negative emotions, it's almost self-sympathy where we can see ourselves instead of just something to eradicate at any cost.
Right.
So,
yeah, we judge ourselves. Yeah, right. Exactly.
And I think a lot of times too, that's where therapy talk, when it goes into mainstream, gets confusing, because people hear, oh, I need to affirm myself, or I need to tell myself that this is great, I've got to do what's right for me. But that's originally meant for people who are depressed and maybe have some self-loathing. It's not meant for the majority of us high self-esteem Americans who sometimes have too much opinion of ourselves. You know, you go to a grocery line when someone thinks they've been cut in line, and you'll see what a big deal it is.
Yeah.
So.
Right. Yes. So you were when you were talking before, I was having a great thought, and it went right out of my head.
Sorry, I do that a lot. So we were talking about holding up different emotions. We were talking about how you see yourself in the fear, or you see yourself in the anger, and you can process it, and it becomes part of you, as opposed to just lopping off that part of the body.
Yeah. You get the whole rainbow, not just the happy colors. You get the indigo too, and that makes it a more full and complete rainbow. You are more full and complete when you have ownership of everything that happens inside of you, rather than lopping something off.
But that is countercultural, because especially in psychiatry, a lot of the marketing is, you don't have enough serotonin, take this drug, or you're feeling down. All of the TV commercials, you see the sad Zoloft cloud, and it's not saying you need the full expression, it's, oh, we need to get rid of the sadness at any cost. What you're saying is, let's concentrate on having the full rainbow of emotions and resilience, so we can have more ways to cope with things. And
often antidepressants, Zoloft or Effexor or what have you, even the ketamine, helps people have the strength and the tolerance and the endurance to get through therapy and group therapy, because it's really hard work. It's really hard work. And once the person has experienced doing that, we can't just talk and say, let me tell you what it's like to ride a roller coaster and have you really understand that, right? You have to really experience it. So once people have experienced that in their life in person, it changes everything. Yeah,
and this will ruin the wisdom you just shared, but there's an old joke where there's two groups of people, and one group is told to mime that they're on a roller coaster, and the other group is told, oh, these people are constipated. So it's a great riot, because it's just people going like this. But you're right, it's just something that we cannot explain, and when we try to interpret it. So, and that is one reason for the group. A lot of our patients have gone through ketamine therapy or transcranial magnetic stimulation, or even EMDR or good counseling that's radically changed them. But then the issue is, well, what do we do? What do we do with the ability to get up in the morning, or the ability to do more? And I told you I went and talked to a place in Columbus earlier today about ketamine, and I reminded them, well, the purpose is not so that these patients do this bravado that insurance will pay for, that doesn't cost them anything. And then now they're getting higher scores on the video game that they're playing in the basement all day. The purpose is, we have more brain capacity, and now we can make ourselves more useful. Not necessarily economically, but just being able to be in communication with others, be in relationship with others.
And be in relationship with self, right? To have a good, solid relationship with yourself, and be comfortable in your own skin. So that when I have relationships with other people, I'm not worried about, what if I say something wrong, or what if I do something wrong, or or if the boss says, come on in my office, we're not biting our nails immediately.
Right. And we can, even the idea of constructive criticism, which is a lost art, we can take something that someone says without being defensive immediately or trying to excuse ourselves.
Absolutely. That's about helping each other. It's not about judging each other, right?
Because now that our office is much larger, I think there's about a dozen of us working there. That's something I've had to work on, of, oh wait, I'm trying to explain why I'm doing to everyone, but it comes off as defensive. And sometimes it has to be, well, here's what we're doing for now. we'll evaluate it and then go from there.
That's what I was going to say, is that a lot of issues really have to be looked at in context, like coming into the office and talking about something is different than living through it, right? And in a group, there's a whole context there that kind of mimics the outside world in many ways, like the group becomes a family, kind of. And so we can begin to really, to really change things when things are seen more in context, as opposed to, just sitting in an office.
So what you're saying, it's sort of like when you go on a first date and it's just the two people, they're not really getting any context. You can go on several first dates, or you can have even interviews with people. I've done that before, like, wow, that's an amazing person. And then I hire them, and then I realize, nope, no, they're not.
No, they're not, right?
So when I was dating, I would try to my group of friends with their group of friends, because you can't be different when you're with your friends, because they'll be like, hey, Nick, why are you being normal? We all know you're weird. Quit it.
Yep. Exactly.
I know it's supposed to be the opposite of why you're acting weird. You're supposed to be normal, but
I'm with the not normal club.
Exactly.
Yeah.
So you're saying in a group therapy, it quickly helps, so it's not this performative, oh, here's how I'm doing, therapist, but it's immediately everyone becomes their self, because it's a whole group.
Yeah, the invitation is to be self, and really it does kind of become a microcosm of their world, of everybody's world, and you can bring that in, that whole outside world into the group and work it with everybody else in the group, and it's just the coolest thing. It's just cool. I love group.
So you'd all better sign up for this group we're having, otherwise I'm signing up. I already told all the employees, like, okay, we're going to open this up for our patients, for people who've never been patients here, but if they don't come, it's us. We are totally doing it.
Oh, very good. That would be so fun.
Going to enjoy it. So either way, because that is part of it. Like when we've talked about this, that was our main decision, that like, this sounds like it'll be really fun to do. And in our culture, sometimes we lose that. And you can tell. You'll go to a doctor's office, or you'll go somewhere, and you're like, oh, nobody's here because I enjoy it.
Right. And again, even if you come for kind of just personal growth, there's some challenge to it. And there's some hard issues that will come out. And that's wonderful. That's wonderful, right? To get to know those issues that maybe you didn't know were hanging out in there before.
And it does take some sacrifice, too. Like at first, we're looking at doing this through insurance, and then we realized group therapy through insurance, it's sort of like a Groupon that may work or may not work, but it's a whole lot of work.
Right.
Which I've done those before. It's, in fact, one time I drove 40 minutes to a hospital cafeteria, because that's where it turned out the Groupon was from. And because I'm very stubborn, I went there both times to get my money's worth, but I was literally driving 40 minutes for cafeteria food for my 20% off.
Wow.
That's usually how I explain insurance to people.
Right.
That's how it works in our system.
That's kind of right.
But it is starting on September 20th until Thanksgiving. It'll be $50 a session, or $295 for all 9, which I think ends up being about $30 each.
Cool.
And then I thought, well, we should talk about this on the show, because that way people kind of know what they're getting into.
Yeah, sounds great.
The one last thing I wanted you to explain is, a lot of times when I've heard about Gestalt therapists, I nod and smile, but how is that different from other types of therapy?
Gestalt therapy, well, you've probably heard the expression, the whole is greater than the sum of its parts, right? And so we all have parts in us. Our angry part, our happy part, our student part, our wild part, whatever. And Gestalt for me is about learning about all of those different parts of self and being able to be more effective with them. And a lot of it is body process too. So in Gestalt, I'll ask people where in their body they're experiencing something, and we'll help people actually to identify emotions by identifying the sensation and then putting a name to it given the situation. Because a lot of people don't even know what they're feeling exactly. Right. And research shows that once you verbalize an emotion, the intensity of the emotion immediately drops, right? And so even just identify it and expressing it, getting to know these parts of self. So I use a lot of my own proprioception and my own physicality in doing group. That's how we learn to do it, is what's happening in the therapist, and what does that mean, and what are you doing as the client, and what does that mean, and we work off of that. Right.
Because I skipped the part where I talk about how you've taught at UMed and all of your accomplishments and how you basically taught most of the Akron therapists about Gestalt. But I mean, it kind of goes without saying, this is such a prestigious show that we have here.
Actually, I teach everybody about CBT. I teach everybody in Ohio CBT for psychosis. Mm-hmm. So I am with the Academy. I'm a diplomat from the Academy of Cognitive Therapy, but I'm also an advanced Gestalt therapist as well. So I'm, orientation-wise, I'm bipolar, I guess.
But it's helpful because it's always better to have more than one tool.
Oh my gosh.
Because otherwise we're like, oh, this is exactly what's going on with you, just because it's what we know the best, so that's all that we can see.
And oddly, the two orientations fit beautifully together.
Absolutely. So if anyone wants to join you for group therapy, they can go on our website, ascendhealthcenter.com. They can call us, 330-754-4844. We're also on Facebook and Instagram and YouTube, which is typically a poor way to find your way somewhere, but it's fun. Everyone has their own way that they like to communicate. So, and you can also text us, which is fun.
Oh, cool. Yeah, that's right.
Because I have a lot of patients who are like, do I really have to go through this phone tree and press 1? And so you can text us, it's easier.
Yeah.
So, well, thanks very much for being on the show.
Well, it's a pleasure to be here. Thanks for asking. Yeah.
Now I have to go coach soccer practice, so I'll try to use everything I've learned today
there you go.
to help those 6th through 8th graders.
Cool beans.
Well, thanks again for coming on.
You bet, Nick. Thanks.
That was really helpful.
You are watching WCTV, Wadsworth Community Television.